And thanks, Nigel. We've tried to complement each other so there's not too much repetition, and I won't go over the principles of training. You covered that really well, thank you. I just want to talk a little bit about the background of why we became so interested in exercise in people with a Fontan circulation. Adults born with congenital heart disease, and sorry everybody, are at an increased risk of being overweight and inactive, and it's a huge problem I see every day at work. And as you've so poignantly pointed out, that lots of people born with congenital heart disease have just been wrapped in cotton wool from the beginning of their life. And those habits are really hard to change. If you weren't involved in sport as a kid and you think that you're crap at it, it's really hard to be very motivated to then get involved in exercise later in life. And we know that adults with congenital heart disease have negative body image and reduced self-esteem. The scars that you have on your chest, I was just speaking to somebody yesterday who was telling me about how they were teased at school, about, all those things have really important effects on your perceived ability to exercise. And some of you are just anxious. There's this grumbling kind of thing there about, will something terrible happen when you exercise? And I've already said today, lots of my patients that I look after have been told by others in the dark ages that they should never exercise. And some of you have probably been too sick, and you might have been in and out of hospital or just been a bit frail to kind of know where to start. Why bother? So in adults, we know that in normal hearts, regular exercise reduces the risk of cardiovascular disease, diabetes, cancer, and blood pressure as well in people with hypertension. And it's also a great way to help control your weight. And our research, a few of you here were part of this research project where we resistance trained or did strength training in a bunch of adults with congenital heart disease. And we showed that, and similar to Nigel's research, we had really important improvements in exercise capacity, and strength improved, and heart function was much better. And we've talked a little bit today about how dependent you guys are on the other pumps in your body apart from your heart, so that breathing in with your lungs and the peripheral muscle pump. And when you move around, those pumps in your legs are squeezing blood back up to the heart. And we know that regular exercise in people with congenital heart disease reduces the rates of stress, anxiety, and depression. It improves self-esteem and body image, and it also reduces symptoms of breathlessness. And especially in people with a Fontan circulation, obesity is bad news. So not only does it increase the work every time you move around, but if you carry a lot of weight around your chest, it's as though you've got a band on your chest. So it's increasing the work of breathing, and it's reducing the efficiency of that suction of your lungs with each breath that you take. And it's a really important problem. And we know that more active people have a lower risk of hospital admissions in the setting of congenital heart disease, and habitual exercise has been shown to have a greater impact on fitness and exercise capacity than the heart function itself. So those measures that we do in clinic, or with the echo or the MRI, and sometimes we might say, oh, you've got mild ventricular impairment. It's much more important that your fitness level and how much activity you can do than what we're telling you is wrong with your heart. And we know that your fitness level is actually the most important thing that determines your long-term good health. It's not whether we tell you your heart has mild impairment or not. And so just being fit and keeping yourself active is one thing, a really important thing you guys can do to keep yourself as well as possible in the long term. So as Nigel has said, we have no evidence that doing evidence is risky. So all that historic crap that people were told is complete rubbish, throw it out the window. But it is important that it's done in a supervised way and that you talk to your cardiologist first, because sometimes there's a little bit of tweaking and we do need to give you some guidelines. So of course there's a risk that you can sprain a muscle when you're doing exercise. It's really important, especially in people with a Fontan circulation, that you don't let yourselves get dehydrated. So don't go running out on a 32-degree day and not take some Lucozade or something with you. Just keep your fluids up. If you've got abnormal heart rhythms, sometimes we might want to sort of optimise those before you start doing a lot of exercise, because when you're getting your heart rate up, you can precipitate those heart rhythms. And we don't like people with Fontan circulation holding their breath. So if you're doing really intensive weights and you go like that, your blood pressure can suddenly drop through your boots. So it's really important if you are doing weights that you do it in a proper way. And I'll talk to you a little bit more about that in a second. And similarly, if you've got severe valve or heart dysfunction or a severely dilated aorta, the tube that comes out of the heart, we might recommend you do lower levels of exercise, because when you take it to that high level, your blood pressure naturally goes up and that puts a strain on things. And that's some of the reasons why we need to sort of give you a little bit of guidance about what you can be doing. So first of all, go and talk to your cardiologist about what is safe for you and what the goals are. And I know not every cardiologist is that great at giving people guidelines, and I'm happy, if sometimes people just send me an email or ask a question, and I'm more than happy if ever you want to get in contact. And a tiny bit of exercise is better than no exercise. So don't get too disheartened if it's difficult to find the time. And incidental exercise and your general level of activity is super important. So park far away in the car park, or get off a bus stop early, or take the stairs and not the lift. I mean, those kind of things just make a huge difference. So start with attainable and modest goals and slowly build on the duration and frequency. Choose something you enjoy. I've already owned up at another of these talks that I've spent like $600 on a gym membership and went twice and never went back, which was so dumb. And so, ideally we say 5 times a week, 30, 60 minutes a day, but even a slow walk for 10 minutes makes a difference for your exercise capacity. So don't be too hard on yourself if you're, not able to do, put those big time restraints on yourself, and avoid sudden bursts. It's much safer if you sort of slowly build on your level of exercise. And what is the best type of exercise for an adult with a Fontan circulation? Well, my personal opinion and our research has suggested that it's important that you have some degree of resistance in your exercise. But even walking, and Nigel showed you that nice graph where the arrows went up for the level of exertion with the different exercises, even walking has a degree of resistance training. So if you want to take it to the next level, you can include some sort of resistance or some circuit training if you like going to the gym. But it really depends on your heart function and rhythm as to what level we'd say you can take that to. And just also as an aside, scuba diving is not safe for most people with a Fontan circulation. So just talk to your cardiologist about that. But you're at increased risk of the bends, if you've heard of that. And as I said, avoid big breath holds. This is a picture of a T-shirt from our Fontan training program. Some of the people here are probably groaning, remembering us in the gym 3 nights a week doing resistance training. And one of my friends here who was part of that training project had never owned a pair of sneakers before. I mean, you guys have just been given, you've just grown up thinking that you weren't supposed to be doing this kind of stuff. So it's a real frame shift. So what sort of level of exertion should you be aiming for? So with cardio exercise, just like Nigel's graph for kids, generally I tell people to try and exercise at a level where you're a bit puffed out, but you could still be talking and saying, what are you going to do on the weekend? If you can't finish a sentence, it's probably, it's not necessarily the optimal training level. And if you want to get a bit more scientific about it, you can use a heart rate monitor. But that formula that you might have seen at the gym about 220 minus age just is useless in people with congenital heart disease. So we need to determine your peak heart rate from an exercise test. And then if we've decided that you're safer managing at low levels of exertion, then we would recommend that training at about 50% of your peak heart rate. And if we think that you're more, moderate levels of exertion are fine, then sort of aiming at sort of 75% of peak heart rate is usually a moderate level of exertion. And some people love exercising with their heart rate monitor on, but you don't have to get that scientific about it. And in terms of resistance exercise, like I said, anything you do has got a degree of resistance exercise. But if you want to start doing some strength training in the gym, when we talk about reps, each of these is a rep, and a set is a set of however many of these you do. And so usually we'd say a set goes for 90 seconds. And if you can do 10 to 15 of these reps in 90 seconds, and you breathe each time you do it, You don't go, that's not good, and you could faint. So if you can do 10 to 15 reps, that's a moderate level. If you can't complete 8 or 10 reps in 90 seconds, that's high intensity resistance training. And that's actually what we did in our training project, but I think unless you've been carefully trained and somebody's watching over your shoulder, I think you get the same gains for aiming for that more moderate level, so 10 to 15 reps in a set. And usually we'd say have a 30-second rest, and then you could try and do 3 sets. And gradually you'll find that you'll be able to lift more and more weights, and you just gradually increase that. But if you do start doing that, please do it at the gym and get one of the trainers to show you how to do it properly before you go rupturing a tendon or something. Okay, so special situations, like I said, major aortic dilation, ventricle dysfunction and valve problems, we usually would prefer you to be doing lower levels of exertion. Warfarin and contact sports, bad news. So rugby's out, and skiing, snowboarding, water skiing, which I know is a big deal. And talk to your cardiologist about it. Sometimes if it's safe for you to be off warfarin for a few days, sometimes for some of my patients we'll stop it for a few days while they go to the snow, but not everybody is safe to do that kind of thing. Frequent arrhythmias need to be sorted out before you start training. And if you've got a defibrillator or a pacemaker, sometimes we might need to optimise the settings so your device doesn't get confused when your heart rate goes up on exercise. But you can certainly do exercise when you've got a device in. I just want to briefly talk about fenestration at the end. So just in case you don't know what on earth I'm talking about, fenestration, it just means little window. So this is a Fontan single ventricle heart. This person's missing one ventricle, and the surgeons created a Fontan circuit up through their heart. And so all the blue blood from the legs and the lower body is channeled up straight onto the pulmonary arteries, which then go into the lungs where the blood can pick up oxygen. And the surgeons made a little window here, and the reason for doing that is that if the blood flow to the lungs is too slow, so there's not enough blood getting into the heart, there'll be a back pressure here. And this little window lets blood blow off and fill up the heart to make sure that the little child that's having the Fontan has enough blood pressure and enough blood flow. And that's at the expense of some blue blood sneaking across into the heart. So it means that the oxygen saturations come down a bit, but we use it to maintain blood pressure. And sometimes that fenestration stays open. And not infrequently, we've got lots of patients with open fenestrations. Sometimes that can cause problems, and we might think about closing it, and we use a device that looks like this, and we feed the catheter up through the leg, that line there is the catheter, and we use this little device to plug the hole. So that's what, when we talk about fenestration closure, that's what we do. And when do we close it? It depends. And this is when I close a fenestration. Not everybody would 100% agree with this. So the first question to ask is, do you need that fenestration? There are some people who need that blow off, otherwise the blood flow to their body becomes too low. So if we're thinking about closing it, we need to close it in the lab with a balloon and see whether whether all the pressures and things remain okay when we do close it. So if you don't need it, then we can think about closing it. We don't just go in and close everybody's. If your oxygen levels are low, and especially if they're dipping down on exercise, that can make you quite puffed out. So if we think that it's affecting your exercise capacity, we'd certainly consider closing it. If you've had a stroke or a mini stroke because clot has snuck across that hole, as long as we think your heart will tolerate closing it, we would definitely want to close it. And my personal practice is if somebody has low oxygen levels that wants to have a baby, and they don't need it, I would also close it, because low oxygen levels increase the risk of miscarriage and having a small baby. So if you don't need it, I would also close it in that setting, but not everybody would do that. So in conclusion, everybody with a Fontan circulation can benefit from exercise for a healthy heart, mind and body. And regular physical activity to maintain healthy muscle and cardio fitness may be even more important in people with a Fontan circulation because you're so dependent on the peripheral muscle pump. And each of you will have different optimal training zones and goals that need to be established with the help of your cardiologist. And if you need help, feel free to email me anytime, and I'm not giving you my mobile number, although some of you already have it, here. Thank you very much.
Okay, so we're just going to have a quick discussion to our speakers, if anyone has any questions.
Can we have the mic? Yeah.
You've alluded to high intensity resistance training and more or less avoiding that. Why are we avoiding high intensity training?
I think if you've got good technique, doing higher intensity, sort of around 8 reps, is okay. But it's just that people's technique is not perfect, and when you get to those higher levels, people tend to breath hold. So, and you see it all the time when you look at the guys in the gym, sort of going, and it's just
I'm guilty of that.
Yeah. So, and it really can make your blood pressure drop through your boots. And the last thing you want to do is fall over with a dumbbell on your head. Yep. So I think, and there's actually little gain. So to build muscle bulk, the 8 to 10 reps, 3 sets, when you weigh up the sort of, you're building muscle bulk. So I know that's what a lot of guys are focused on. And that is still a good training regimen for building muscle bulk.
Yes.
Hi, and this is more for Nigel. Just regarding children, I've always kind of liked the idea of self-defense training, so martial arts. What would you say about that in terms of children and physical?
Yeah, that's a really good question. I think it really depends on what sort of anticoagulation your child's on, and that should be guided by the cardiologist. You know, the cardiologists don't really like contact sports. So if your child is doing martial arts and they're on warfarin, your cardiologist is probably unhappy about that.
Mine's on aspirin, so I was hoping not quite as...
Again, I would get...
Yeah.
That's more of a kind of a question for the cardiologist. I think it depends how much contact they're doing as well. If they're sparring, you know, or if they're just doing exercises, it might change. But you should have a conversation with your cardiologist about that.
I have an opinion. I think that you should enjoy life before anything, so go for it. But can you... yes, behind you, Louise.
Hi, I have recently been seeing an exercise physiologist, which I don't know if people are aware that we're entitled to see them, and it's covered under Medicare. How will information be disseminated to those types of people? Because obviously we're a very specific group.
Rachel, if you're happy, I can. We are, so David, Rachel, Nigel, some people from Newcastle and some people from Western Australia are intending to build up a grant application for disseminating exercise training program, but on a long run, to have them to look at maintenance of exercise training program. And one of the key players will be an exercise physiologist, when the only one in the country who's got an academic track record. And so the plan will be coordinating with exercise physiologists in the country and try to, if we get the money for for this, the idea is he will teach a little bit exercise physiologists about the fontan circulation, and we'll try in the next year or two to disseminate the information, because as you said, normally if you go under the criteria of chronic disease, you have access to 4 or 5 consults of exercise physiologists per year. And we'll try to build up maybe a booklet and information for
It's also difficult because when an exercise physiologist will go and look at the American Heart Association and the European guidelines under Fontan, and there's a new one coming out soon, but it says low level of exercise. And that is based upon nothing. But you might find, a lot of you, if you go and see an exercise physiologist, they'll say you can play billiards and go bowling. I think it's important to say, do you mind having a conversation with my cardiologist? But also all our publications, they're available in the medical literature, so they can sort of Google stuff and things like that too.
I have a personal agenda and a question. I'd like to know in the audience here whether can you raise your hand if you are doing a fair amount of exercise, or who's doing a fair amount of exercise, quite a bit of exercise. Not that many. Okay, who can you tell me if your saturation? So keep your hand raised. Keep your hand raised. Okay. Can you put down your arm if you know that your saturation is going below 85%? So below 80%? No, even less. So below 90%? No, I'm curious because I get the feeling the more I see people like you, all the ones who are pretty good at exercise are pretty pink, I think. And
I do think that deep desaturation affects exercise capacity, but I mean, I've got one person who, I often will see people with normal 100% peak exercise who desaturate to 88% on exertion. Not the deep, like really deep ones, but often they'll sit sort of low 90s, late 80s.
the one who desaturates at 88%, does he have an open or closed fenestration? Because you can desaturate and have no fenestration.
Yes, she doesn't have a fenestration, that person. But I agree. I mean, I have a low threshold for wanting to close the fenestration.
Do you think that if you want to exercise a lot, do you think you would recommend to close the fenestration, or you're getting there a little bit, no?
I would get an exercise test, and if they desaturate and they're hyperventilating on exercise, I'd close the fenestration.
If you desaturate, define desaturation on exercise then.
It depends how deep, but you look at all the other things at
80,
cardiopulmonary
85.
exercise test. I definitely, if it's getting below 85, no question. But 85 to 90, I think it depends on the person.
Most of those with open fenestration will go below 85% on maximal exercise, no? Okay. Lots of questions, yes.
I was just going to say, it's not really a question, it's more of a statement. When I exercise, sometimes I can drop quite low from the fenestration, and I dropped as low as 65 before I felt any symptoms at all. So I don't know as to what you were actually asking for, but mine can drop quite low. It doesn't mean that I have symptoms when I exercise.
I come from a team where I was convinced that fenestration was good on the long term, and now I'm asking questions. So I don't want to put out bias here. I'm just trying to investigate and find out. I think that's an interesting question. That's something that we need to find out within the next few years. Exercise is really important. And so if having an open fenestration prevents you to get maximal exercise, if you're not as competitive, then you should close it, I think. That's what we have.
Yeah, well, that's what I'm wondering for myself, whether it should be closed long term, because it could be impacting the amount of exercise I can actually do.
An excellent question. Yes, Rachel, maybe you're here. Yeah.
This is just a general question. So does it depend on you as an individual as to how much exercise and what your saturation cutoff, like the bottom, would be? Because with my son, his cutoff is now 75 post-Fontan. So a high day for him, or a really exceptional saturation, would be like 89, 90. And so I'm just wondering, he does tear around and love to run around, but I don't really see that much of a difference from pre to post Fontan. There's been an increase in his saturations in how they read, so pre-Fontan, low 60s. But as far as how he presents when he exercises, I don't see that much of a difference.
I start to have biased views, so I'm not sure that I have to comment.
But also, when you chronically have low oxygen levels, your hemoglobin levels go up to compensate. So you're already, I mean, and we all have people with chronic cyanosis because they're sort of compensated differently. Suddenly you come down and you don't have a high hemoglobin level to compensate. There are no hard and fast rules.
And I may be wrong, but the way I see things is that, and I don't have cardiologists who are pro-open fenestration in the audience, so it's not a fair fight. But if you have an open fenestration, my guess is that on maximal exercise, if you have a good, decent fenestration, your oxygenation go below 85%, and my bet is that your exercise capacity is decreased. And I may be wrong, but at the end of the day, we do the Fontan surgery to have a good functional outcome. We're not doing it to keep alive kids who are crippled. So what we want is people who are able to walk, exercise, and do the normal things. Maybe not being as a national level like Holly, but being able to enjoy life. So if you're walking around with saturation of 75 to 85%, that's not good. Personally, I'm not happy with that. You're working even 80, 85% on an everyday life. I think that's not enough. But
there are some things that need, there is a group of people. Not always.
but you should check if you have saturation on a regular basis less than 85%. You should check the cath. Behind, yes, yep.
I just have a question for Nigel in relation to children. Holly's mum said before that Holly wears a vest sometimes. Our son plays hockey. Is that a recommended item to wear?
I certainly think I've seen some bad hockey injuries without taking anticoagulation. It doesn't seem like an unreasonable idea. I couldn't give you a specific recommendation on this one.
Thank you.
Just something we did that wasn't something anybody told us to do.
Yeah, thank you.
Yeah, some questions here, there.
My question's for Nigel as well. I've got a little 15-month-old boy. I've just noticed as he's becoming more and more active that he doesn't necessarily self-regulate as well anymore as he did when he was a little baby. In terms of, encouraging exercise, I guess it's, as a parent, being able to help the little ones to regulate their fatigue with exercising. I guess my question is if you've got any tips, and, I don't want to necessarily push my child too far without him getting too tired. So I guess, it's that balancing act.
I don't think that you can push him too far. I don't think that's a risk. Huh? So, yes.
Yeah, I was just going to say what we do know from research into young children with Fontans is that if they get wrapped up in cotton wool balls, then they tend to have a lot more anxiety as they get older. And so, certainly we do think they self-regulate. And I understand your concern that you get worried. But it's also quite important that your child explores their environment and, develops quite normally as well. So I'm sorry that might not answer your question.
Thanks. Obviously, a good level of overall fitness is sort of what you're aiming at, but I wonder if there's particular sort of muscle groups that are particularly helpful, and particular exercises like squats or calf raises or walking up hills or whatever.
Really good question, great question. So, and based upon our research, we've really focused on the calf muscles, so calf lifts. So even without weight, but if you're at the gym, it's the one where you sort of, I'm sorry, you can't see me standing on tippy toes here, but like, you know, those kind of exercises. But even if you're at home doing just, and also, you know, if you want to do some leg press and knee extension and knee flexion as well, building on the, I think it's all right to do a little bit of upper limb resistance, and there is evidence to say that even, you know, sort of moderate intensity is okay in severe heart failure patients. So we sort of built in full body resistance, but if you want to really focus in on any particular muscle groups, I think the lower body is probably a bit more important than the upper body.
Yeah, sure. And in children from kind of age 12 to 15, they can still do those exercises but without weights. And really what we focused on in our research was things like squats, lunges, box jumps or star jumps, and also calf lifts as well, really mainly focusing on strengthening their big muscle groups in their legs.
Did you have trouble, Nigel, with your kids in breath holding squats, or they just keep breathing?
They just keep breathing, and also because they're not lifting big weights, you know, they're less likely to Valsalva as well. Yeah.
Yes, here.
Well, that's loud. My question's kind of more on the other side of exercise. Sleeping-wise, I've got a pacer as well, but it sort of doesn't matter what I do day to day, whether it's a lot of exercise or if I just have sort of a normal day at the office. It's 6 or 7 hours, and that's it. I just wake up. There's no like if I've had a big day, there's no sort of sleeping for 8 or 10 hours. It's just 6 or 7 hours regardless. Is there any sort of effect from the Fontaine, or?
Just wait that you're going to be my age. But
I'm not quite, just ask the question again. I'm not sure I'm following what you...
He's not sleeping more than 6 or 7 hours. After 6, 7 hours, that's it. He has to go out of bed. That's
right.
Yeah, so I'll stay up till, 11, 1 o'clock at night, but then I'll get up at 7 o'clock or, and it sort of doesn't matter whether I've had a big day or...
Whether you're exercising or not.
Yeah, it doesn't...
Probably more just your natural sleeping pattern. Sorry. Probably genetic.
Can I ask you? You said because there was a dad who just asked me before about breath. His son is doing breath hold diving, which I found surprising, to good depth, 25 feet, and he wants to do more. And you say that scuba diving is not safe for most. And although I'm an addicted scuba diver, I told him that he would find no doctors ever who would agree with scuba diving. Are you one that would agree for scuba diving?
If somebody has oxygen saturations of 100% and they do not desaturate, it's probably okay, but it's not 100% okay, because if you've got right to left shunting, you're at much higher risk of the bends. So, which is little air. So when I say the bends, what I mean is naturally little, as you decompress, as you come from depth up, all the little gas bubbles that were squished down start to become big bubbles. And if you, in a normal circulation, they're filtered out by the lungs, because the lungs are like all these tiny capillaries, so those air bubbles are filtered out. If you've got somewhere in your body where those air bubbles can sneak across, it can cause a stroke, and it can be catastrophic. And actually, 20% of normal people have what's called a patent foramen ovale, and that lets blood sneak across. And we've had a couple of professional divers that have had stroke, and we've had to close the hole. And in Fontaine, they've got tiny little AVMs in their lungs. And so I think it's dangerous. And unless you had oxygen saturations that were 100% and you did not desaturate on exercise, I'd advise against it. And even if you do have normal oxygen saturations, my feeling is that they've got little shunts all over their body and it's probably not safe.
And then you're breathing compressed air as well. Huh? So what does it do? It's like a pipa. You don't know
No,
how much-
oh, you mean, so the breath hold diving, yeah, I mean, I think,
breath
sorry.
hold diving, I think is all right, but it's the scuba diving.
So
is,
breath hold diving, just because I'm not a breath hold diver. So you hold your breath and then you just go deep and come back up. I mean, personally, I think that's super dangerous. I mean, they could just lose consciousness. Your cardiac output. I mean, we've looked at this. We got.
I personally think it's dangerous, but he's doing it all
Yeah,
right.
if he's doing it, but I wouldn't take it to the next level, and I would make sure there's somebody around. I mean, we've looked at this with our Fontan people when they hold their breath in the MRI scanner, their cardiac output or their blood flow to their brain just goes. Whew. And so, I mean, if he loves it and he's not doing big depths and there's someone around, I mean, I hate telling people that they can't do something, but I'd be uncomfortable taking it to the next level.
What would you call the next level?
Well, like, how deep are we talking? Like, how long do you hold?
He's going 25 feet and he's doing 1.5 minute breath hold diving. It's good. At 12 years old of age. I think we can make a paper one day on. We can make a paper one day about what crazy stuff do Fontan people do.